This meeting is being recorded.
Welcome to the Ashby Village Science and Ideas Group. I'm Joe Ebinger, and I coordinate this group's events with the help of our co-host and tech expert, Hillary Naylor. All of our members here have different educational and work backgrounds, but we all share a common interest in science and new ideas. Currently have over 70 members in our group and another 100 on our guest list. We meet via Zoom every Thursday, the Thursday of every month, that is, from 3 p.m. until about 4:30. We have different guests each month who speaks on a topic related to science and ideas. Coming up next on September 12th, we have Dwayne Silverstein of Ecology, who will explain to us why islands are uniquely important to critical conservation efforts. We're always looking for new speakers. We're completely booked for the rest of this year, but wide open for next year. If you personally know someone, please recommend them to me along with their contact information. We invite all Ashby Village members to join our group. Others interested in Ashby Village and our presentations are also welcome. I have to say that Ashby Village is a 501c3 tax-exempt nonprofit organization. I ask Hillary to put a link to our website in the chat. To our guests, please consider a donation to Ashby Village to help us continue these kinds of presentations. Now, Sarah Ebinger will introduce today's presenter, Mary Kawar. Sarah.
Hi, everybody. We're so glad you're with us today, Mary. Mary is an occupational therapist, and for 60 years plus, she has developed and implemented innovative therapeutic strategies for clients of all ages, employing her expertise as a clinician, educator, and program developer. She lectures internationally for allied health professionals, specializing in vestibular processing as a foundation for sensory processing and motor control to enhance physical, emotional, social, and cognitive performance with clients of all ages. Her passion for incorporating relevant scientific research has fueled her success in creating novel therapeutic strategies that enhance treatment outcomes. I guarantee you, Mary, we are very eager to hear your talk.
Oh, well, it's delightful to be with all of you. The vestibular system is what I'm most passionate about. I have actually, as a child, I had vestibular issues that were never identified until I was actually, I self-diagnosed them when I was doing my undergraduate work. And so I have found over the years that when people ask what I do, and I say I lecture and work with vestibular problems, I still find many people that say, "What is that?" While it's one of the oldest sensory systems, it is probably the least understood, and it has only been since I think the advent of the space travel that the really important research has begun to open up, and there's still so much that is yet to be determined, because it is such a vast network in terms of our neuro emotional physical behavior. So I'm just going to be touching upon some aspects of that, certainly related to balance, because balance is critical to our survival from the time that we are born and until we die. And what's interesting to me is I really specialize primarily in working with infants and children. That the vestibular issues is one of the most common problems, and it's not an isolated problem because the system interacts with all of the other sensory systems. But as I've gotten older, I have begun to experience my own challenges with maintaining balance. My balance is certainly not as good as it used to be, and I think that perhaps many of you that are with us today are finding the same thing. And particularly because we live in a society now where we really don't have to move. We have all kinds of vehicles. Like tonight, I'm going to be flying to Toronto. And even thinking about our infants, I feel that in order to have a baby, you almost have to have at least 15 devices to carry them around in. And so we just aren't moving as much. And yet genetically, we are designed for movement because movement is a part of life. If there's movement, there's life. And so it's really a critical part of our functioning. I thought I've had the opportunity to actually work with some of the space researchers and have incorporated a lot of their ideas into my equipment and therapeutic strategies. And in fact, I've had the opportunity to ride in one of their devices that they use with astronauts to, some of the astronauts don't have really good vestibular function when they come into the program. And so it has to be developed. So this is a system that really responds to intervention. And so I'm going to show you I have a slide and a video. This is me in this device that's used in the space program. They have, this is just one of many devices, but I think you can see, it's not terribly clear, that I'm actually strapped into a seat and there's a hood that's going to come down, and then it'll be total.
Hold on a sec, Mary. We can't see the slide that you're describing. We still see the first slide.
Yes.
I clicked on a new slide.
I think you clicked on I wonder what happened.
Perhaps on the left, whatever slide.
Double
We can see your pointer, but we don't see the slide advancing when you click on it.
Correct.
I don't know what to do. It's up on my slide. You were seeing the first slide, weren't you?
There's a suggestion that you need to go into presentation mode in the PowerPoint.
I don't know where to do that. I'm sorry.
Well, on the left, Mary, you've got a vertical column there of
Yes.
different slides. Click on the second one, for instance, or wherever you want to go.
I clicked on that.
Maybe a double click?
And move your cursor over it.
I have my cursor on it and I double click and nothing happens.
Okay, tell her. She's in compose mode.
You're in composition mode and you need to shift PowerPoint into presentation mode or slide mode. There'll be an icon at I don't know what system you're on, so it'll be either on the bottom or under the menu. Slide mode under menu for PowerPoint, top menu.
Not Zoom, but PowerPoint, right?
Yes.
I'm in Keynote.
There might be a presentation or slide mode. Sorry, I'm not familiar with Keynote. I know just what it is, but I'm not a user.
Is it in the PowerPoint interface?
No, it's an Apple version of PowerPoint.
What if you
Apple
click view?
It says settings. Would it be under settings?
Joe, this is Tricia. Lauren is looking into his Apple, that application to see what's going on here. Keynote.
Thanks. Thank you.
Open.
It's opening.
Yes.
Okay, and then we'll have more of an interface so we can look at it. It's just taking a second. We haven't opened it before. Continue.
Is that it?
That's it. Now we see you.
Ah, got it. Great.
Oh,
Thank
so
you very much.
Got it?
okay, so as you can
Okay.
see, I'm in this device, and now the lid is closed, so it's totally black, and you can
so-
see I'm going
You need to, you
I
need-
going in many different orientations. I'm upside down and tilting and turning, and sometimes when
and so,
people
ma'am, I'm
watch-
sorry, but you need to go into share screen again, I believe.
No, she's sharing screen.
it's not showing.
Yeah, you know, yeah, it's showing.
Fine. Maybe we're not.
Okay, we see it now. Thank you.
Okay, so just to show you that in order to activate the entire vestibular system, you have to get the head in many different orientations. You know, most of the time in today's world, we spend our head, we're just in the upright position. So we really aren't moving our head enough to keep that system fully activated. And so particularly as perhaps we've had a really good vestibular system throughout most of our life, but as we get older, if we're moving less, then this system stops supporting our balance, and we begin to have more challenges, but not just with balance. I'll be talking about all of the other implications in terms of our cognitive functioning, and really every aspect of human performance. And so there are many things that can disrupt vestibular functioning. In a lot of children have ear infections, and because of the close proximity of the vestibular receptors in the inner ear to the cochlea, it's going to have an impact on vestibular function as well. And high fevers, and you can have infections of the vestibular system. So any infection, soft tissue swelling is going to compromise its functioning. There can be cranial malalignment, trauma to the head, allergies, stress during pregnancy, and genetics. Many things can challenge this system. I'm not going to go into a lot of those disabilities. What I hope to accomplish today is to inspire you to really ensure that you are doing lots of movement to keep your vestibular system being optimally functioning as long as possible. Because if you don't, then it's going to really impact, as I say, not only balance, but all aspects of quality of life.
Okay.
Yeah.
Thank you. I was just going to say the slide hadn't progressed, but you have.
Okay. So our vestibular system is really an internal GPS system. So now we have all of these wonderful devices, our cell phones that help us get around our world. But it's really interesting to me that we have this beautiful system right behind our ears. It's a bilateral system that really does a wonderful job of keeping our head and body oriented in space and supporting all of the sensory systems. A lot of I'll probably talk more about auditory and visual systems in terms of those relationships. So most fundamentally, in the field of gravity, it keeps us informed without having to think about it. One of the things that makes this kind of a mysterious system is that it functions below the level of consciousness. So when it's doing its job, we aren't even aware of it. It's just always keeping us informed about exactly where we are in the field of gravity, whether we're stationary or moving or being moved by something in our environment. And so it gives us this wonderful sense of where we are in space without having to think about it. So we can be thinking about what we are going to be doing in space because we have this wonderful background of knowing exactly where we are. So here you see a cross section of the head, and this shows the vestibular and auditory system in the inner ear. You see the ear canal, and then you have the middle ear that connects with the oral cavity. That tube is one of the things milk can get from the oral cavity into that middle ear, and that can then get infected and cause ear infections. So that's one of the causes of vestibular dysfunction. And then the inner ear, I think, is quite interesting because it's surrounded by the hardest bone in the body. So it's like genetically, we have done everything possible to protect this vestibulocochlear, all of these receptors. And so you can see the snail-like part of these receptors on the left. That's the cochlea, and that's connected to the 5 vestibular receptors. So it's not just a receptors, it's actually 5 receptors that are needed to pick up all of the different components of linear and rotary acceleration. And this is a fluid-filled chamber. So the vibration from sound and from movement is going to move the fluids that surround this membranous labyrinth. And then within that gray membranous labyrinth is endolymph, or also it's fluid filled. And so it's the movement of the fluids caused by movement of the head and body that trigger the receptors to respond to what's happening. So it's a very, to me, very interesting system that I actually feel it helps one to really be inspired to move when you have more understanding of how this system is designed. So that's why I'm covering this very briefly. And here's the whole vestibulocochlear system pulled out of the head. So as you can see, there are three loops, 3 circles, and they're orthogonally aligned. In other words, they're at right angles to each other. And as I've said, these are fluid-filled chambers. So as we move our head, we're actually moving the fluid in those receptors, and they're triangulated hair cell bundles. So you see I have this triangulation. So it's bending of these hair cells from the fluid movement that activates the receptors to inform the central nervous system about exactly how we're moving. So there's the 3 semicircular canals, the utricle, which is picking up linear movement, and the vertical movement is picked up by the sacculus. So it's 5 different vestibular receptors to get all of the components of linear and rotary movement. So it's a tiny but very, very complex structure. And here's a cross section of it, so you can see the fluid that surrounds the membranous labyrinth. And then, as I say, within the membranous labyrinth is also a fluid-filled system. And here's the hair cells that I was talking about. So in each of these 5 receptors, as well as in the cochlea, there are these, it's a bilateral system. So I'll take just one. There are millions of these hair cell bundles, but I'll just take one from each side. So if I tilt my head, when my head is just upright, the hair cells are standing up. But if I tilt my head to my left, these hair cells are going to fall together and ignite, and the ones on this side are going to fall apart so they don't fire. But if I tilt my head then the other way, these fall together and the ones on my left fall apart. So it's all about hair cell bending. Hair cell bending, it gets converted into an electrochemical charge that goes into the central nervous system and gives us all of this wonderful information about exactly where our head is in space. And this just shows I'm not going to go into any detail here, but just showing up on the left, that's in the cochlea. See the circular canal, the fluid comes around and it bends these hair cells. And in in the utricle and sacculus on the right, you see they're going up into a gelatinous bed. So movement of the head linearly, like moving side to side, moving up and down, forward and backward. That's going to bend these hair cells and tell us the information about that movement. And in the lower left, that's an example of in the cochlea. So in all of these receptors, as I say, it's the bending of hair cells from the fluid movement that causes the signal to get into the central nervous system. And here is a cross section of the central nervous system. And this is one way of showing this really vast vestibular network. Out down in the left, you see the vestibular receptors that are not, they're in the inner ear, not in the central nervous system. And then they go into the VN that you see at the brainstem level. Is where the nuclei, where they go in, and then from there they go out to all these parts of the brain, as well as down through the spinal cord to the neck and spine. And you see the arrows going to all these parts, and notice that there's a point on each end of the arrow. So not only does that vestibular information go to all of these parts of the brain, but all of these parts of the brain can have an impact back, all the way back to the receptors. So it's a two-way flow of communication that gives us all of this wonderful information about our movement in space. And here is another way of showing this. If you look at the green, the number, the Z-axis going like up through the body. So that would be linear movement up and down. And then if you notice the arrow around it, there's movement around that is picked up by the semicircular canals. So the vertical part is from the utricle and sacculus. They're the gravity receptors, and the rotary part, the movement around that axis, is activation of the semicircular canals. There's another arrow going through the ears, side to side. So there's linear movement side to side, and there's also movement around that. And then there's movement through the head from the front of my head through the back, and that would be this plane of movement, as well as the rotation around that. So it takes 5 different receptors to give us all of these components of information about our movement. And as I mentioned earlier, this happens at below the level of consciousness. So when the system is working well, it is informing the entire central nervous system about exactly how we are moving or being moved in the gravitational world. This is just a different way of looking. If you look down on the head to see how the 3, if you look on the left, it's showing the angles of how these 3 sets of semicircular canals are oriented in the head. So depending upon which of those movements that I was just showing you, there would be movement in parts of that system, but not in others. And that's, so it's really, it's relating to exactly how the head is moved. And the one on the right is just showing, looking down on the head, so that you can see just another view of how they are oriented in the head. And there's a very huge network of connection between the 6 muscles that are attached to the orbit of the eye and the 3 semicircular canals. So if we get fluid moving, for example, in the lateral canal, which is the one that it's tilted up when we're in the upright position, it's tilted up a little bit. But if we bring our head down and move our head around, the fluid is going to be primarily moving in that canal, and that's going to cause the eye muscles to do a nystagmus response, fast, slow, in this plane. And if we activate the superior and posterior canals, we're going to activate the superior and inferior rectus muscles. So the eyes are going to have a nystagmus up and down. And I think my next, here's just another one to show that when we move our head, the reflex organization between the vestibular system and the eyes cause, you can see this is the nose up at the top. You see how the head is turning to the left, and the eyes reflexively turn exactly the same amount in the opposite direction, so that if I'm looking at, I can be looking at you and move my head, and my head moves, but my eyes continue to look at the target. And all of that is being controlled by the vestibular system. So it's vestibular activation of the eye muscles reflexively that gives us all of this information about our visual world that is being activated by the movements of the head and body in space. I'm going to show you, this is showing just one of my eyes. I'm being rotated, so you can see when I activate this, you'll see how the just being rotated, I'm not doing anything. I'm just kind of looking at the camera that's looking at. Both eyes are doing it, but it's just showing one eye. So you see that fast, slow movement.
Can you see my eyes as we go around? Can you see any nystagmus?
And when they stop moving, it's going to go in the opposite direction. So that'll happen just in a second here. Yeah, I've stopped, but see, the fluid is still moving. So I'm going to have that nystagmus lasting for a little while until the fluid stops moving in the canal. So just by doing precise activation of the vestibular system, I can improve oculomotor control. And that's one of the things that I've done a lot with the clients that I work with. And you know, not too many years ago, this really was not well understood. And so developmental optometrists and ophthalmologists were often working in isolation. They were treating the eyes, but not treating the underlying vestibular issues. And so they would get improvement that wouldn't last, because that vestibular support was not doing what it is intended to do. So improving eye muscle control through vestibular activation is a very important part of a therapeutic program for many of our clients. So just to show some of the many things that vestibular activation of our bodies, of our heads, you know, of our brains, has an impact on. It has a huge impact on our postural control. So those of us who are beginning to experience some balance problems, you know, it's part of that is quite likely due to the fact that our vestibular system is not providing the neuromuscular system the information it needs to be able to quickly make an adaptive response to the movements that we make in our daily living. And also oculomotor control. I just showed you some of that interaction. And at the higher cortical level, it does a lot to help us with pathfinding, being able to orient to all of the things in our world, to turn our head and orient to the sounds and the sights that are in our environment, pathfinding and spatial relationships, very, very dependent upon this, and our cognitive visual perceptual abilities, just like, you know, the control of the eyes has a lot to do with our interpretation of our visual world. So it has a huge impact on the planning of our movements as well as the execution of them and the integration of the two body sides. You know, this is a bilateral system, so it has all of this impact on the neuromuscular control. And it has a lot to do to support our language development and our mental agility. So things like we hear about brain fog, and you know, possibly some of you could have had experience with that. There's almost always a component of underlying lack of vestibular support for those cognitive aspects of mental performance. So it has a lot to do with our social engagement, you know, as we are getting more preoccupied with where we are in space and how to move safely through space. It really can really compromise our willingness to be engaged in the same way that we used to be. So it has quite an impact on our emotional well-being. Excuse me. And in fact, there's a lot of research now. We've certainly identified and many of us have experienced the anxiety that begins to set in when our balance begins to disintegrate. And so it now we understand that there's not only this vast vestibular network throughout the central nervous system, but there's also an emotional network, and these two are very, very interactive. So it really helps one to understand how, as you feel less confident in your movements through space, you are going to have more stress and anxiety as a result of that. So all the more reason to try to keep this system really active and viable so that we don't lose these functions over time. So knowing that, unfortunately, you know, my preference is really to do live teaching so that I can actually have people do various movements and you know, and coach them through the movements, because my whole mission has been not only just to tell people to move, but to develop strategies that really are very powerful and very specific to enhance the integrity of the vestibular system. So I'm just going to tell you a few suggestions that if you you know, if this has motivated you to really try to ensure that you keep your vestibular system functioning optimally, and especially if you have already begun to have some significant challenges with safe movement, there are lots of things that you can do with using things in your environment, such as a chair. Like one of the movements that you can do sitting in a chair, and I like to use a chair that has arms so that if you're going to be starting to move around in the chair and you don't have good balance, you can hold onto the arms of the chair. And remember, these receptors are in the head. You know, they go throughout the body and throughout the head, but the receptors are activated by the head movement. So one of the things that you can do is to make clockwise and counterclockwise, you know, sit up and, you know, get your spine very erect, and then you're going to move your head on your spine with your neck muscles. So making the biggest circle you can to around the left, going I'm going counterclockwise right now. And then I can do some clockwise movements as well. And I'm trying to make that circle on to the left of my center. I'm trying to make that circle as big as I can with keeping my body stable. Yeah. And that also helps you to keep better neck mobility. And then do the same thing on the right. Make clockwise and counterclockwise circles to that side. So you're trying to go in the widest range possible. And some of you could feel some dizziness from this, especially if you aren't very active. And so you would want to be careful to, just, it would be better to do a little bit several times a day than to just try to do a lot once a day and then don't move your head at all. And then another one would be to now keep your head and your body all in alignment. And now you're going to move as far as you can with your whole upper body all the way around in both directions. In fact, going not just as far in sitting in a chair, making the biggest circle you can, clockwise and counterclockwise, but then take your right hand and bend over, hold on to the arm of the chair with your left hand and bend all the way upside down to touch your foot. So you're getting your head totally inverted diagonally down to the left, and then come back up and then go diagonally down to your right. So do several of those. And this really gets quite a bit of movement in those semicircular canals to keep this system viable. So hopefully this will be helpful for some of you who may not be able to do more active movements. Another way is to stand in a doorway, because then you can use the support of the door frame, and you can turn around. When you saw my eye muscles moving, I was actually sitting on a rotating device, so I was turning, and that was causing my eye muscle movements that you saw. So rotation is really, really good, as well as if when you're lying in bed, if you're on a large enough bed surface, you can roll over from one side of the bed to the other. Rolling is also very good. In the space programs, these simple movements that I'm telling you, they have all kinds of devices that they put the astronauts in to do these very similar kinds of movement to prepare them to be going into a gravitation free environment. As you know, in space, one of the challenges is for them to get movement, because they're not having the vestibular system stimulated, because of this is a weightless kind of environment. And so the muscle development really quickly begins to deteriorate when one is in space for any length of time. And another thing related to this for balance is to maintain foot mobility, because we often, when we're moving about in our environment, our feet are what have contact with the base of support. And neuropathies are very common as we get older. And so keeping good mobility in the feet so that we can make postural adjustments quickly is another thing to do. I also often, when I'm at the sink, I will hold on to the sink and do deep squats up and down, getting that vertical movement by having something to hold on to. So there are just many simple things you can do. But the whole idea is to get your head in as many different planes of orientation. This often is referred to as multiplanar movements of the head, to keep the fluids of these receptors active and moving. And that can oftentimes you can actually improve your ability because that movement of the head is informing the neuromuscular system so that you can in the moment have better balance. Another recent research finding is that if you do a kind of movement that is challenging, it's like the feeling of like you feel like you're going to fall when you have kind of a near accident, but something that is safe, that really stimulates the neurochemistry of learning. And so not only, and I guess the best experience I could think of is if you've been in an accident or been observed an accident, you know how you get this adrenaline rush and you just feel so alert. What they found is that for up to 2 hours after you've mobilized this neurochemistry, that it enhances your processing of any new information. So if you're trying to learn a new language or learn some new skill, it's very beneficial. I've done this myself. Before I try something new, I may even just run in place or just get really physically active or do a little bit of a balance challenge, and it just really floods my entire brain with this wonderful neurochemistry that enhances my ability to learn. And that neurochemical change, the research on it says that can last for up to 2 hours. So I'm just tossing that out as an idea of when you really want to be mentally alert, be sure that you do safe but really active movement, and maybe some kind of movement that has a bit of a challenge to it, to really trigger that neurochemical influence on behavior. Another thought that I have is hydration. As we get older, we start to have more of a problem with maintaining fluids in our body, and we certainly need to be hydrating. And this is a fluid-filled system. These vestibular receptors are dependent upon having a good fluid nourishment to continue to be viable. So for any balance, just hopefully if I've been at all successful, I've inspired you to do more movement, because that's going to help you maintain your balance as best we can. As our bodies begin to, I'm 89 and I do quite a bit of movement every day, and so I feel that I'm really attempting to maintain as much quality in my life as I can for as long as possible, because I certainly find that I have lost a lot of my abilities. I've done a lot of biking, for example, in my life, but I've more recently stopped biking just because I feel like I'm much more at risk for injury. But I'm trying in every way possible to ensure that my vestibular system is there to support not only my neuromuscular system, my movements, but also my cognitive abilities and my emotional well-being, because all of these things are heavily influenced by this mysterious vestibular system. So hopefully that gives you something to think about in your life. And if you have any comments or questions, I would love to hear from you.
Hi, yes, and Trish had a question earlier on. You want to ask your question, Trish?
Yes, thank you for a fabulous presentation. I'm a big swimmer, and I wondered, you mentioned movement, and are you referring to only a movement in gravity to exercise our vestibular system, or when we swim or do aqua aerobics, are we also exercising the vestibular complex?
All movement. You are very active in swimming. You know, gravity is having an influence. It's not as heavy an influence because the water is carrying some of your weight, but all of the head movements that you make in swimming and just everything that we do movement wise is going to have an impact. I just lost my pictures of all of the people.
Yeah, I thought while we had the chat, people asking questions, you want the pictures back?
Oh, well, it's up to you. I don't.
Well, if you want to specifically use a picture to share to answer a question, we can put it back. Let's see, Joan has her hand up. Go ahead, Joan, unmute yourself. Yeah.
Okay, I want to ask a question because this arose in a recent conversation I had with an Ashby Village member who has profound hearing loss and a cochlear implant. And he says that his balance is way off, dangerously off. And I'm wondering, I will certainly recommend that he listen to your lecture, but do you think that that's because of the cochlear implant or because of the deafness or both? And
Well,
would exercises help a person like that?
I think that for him to do as much safe movement as possible is going to have the vestibular system doing the best job that it can. There's a lot of interaction between the, as I showed in the one slide, between the auditory system and the vestibular system. And so you really can't, they're so interactive that you can't really separate it out. I've worked a lot with especially with children who have cochlear implants and have made huge changes in their ability by doing vestibular activation as part of an overall program. So that obviously this is a person who has quite an extensive amount of challenge. So the main thing would be to encourage movement to within their tolerance. You wouldn't want them to, for example, if they're turning their head, you wouldn't want them to to start feeling really dizzy and have lasting effects. So safety and the dosage, just how much to do would need to be carefully considered. So, it's better movement. It's better to do some movement frequently than to do a lot of movement and then no movement. That's something that I personally experienced. Sometimes I will do a morning routine and then I do a lot of sedentary kinds of activities, but I'm trying to intersperse movement activities throughout the day rather than just having a huge input.
But I was asking, because of my curiosity about the mechanisms, I was asking whether that's caused, you think, by his deafness or by the cochlear implant itself.
Well, I wouldn't be able to, there's so many different possibilities that I couldn't, in terms of what caused it, but just, I can speak more from how the systems are interactive. If there's a problem in two systems that have a lot of interconnection, then they're probably both going to be impacted.
Thank you. Jean had a question in from the chat. Jean, you want to ask your question?
Yes, I'm wondering what part of the system is involved in BPPV?
Okay, and I didn't go into that much detail, but within the utricle and sacculus, those two receptors, what we often recall the gravity receptors, the hair cells, the triangulated hair cells go up into that gelatinous bed. And then above that are crystal calcium carbonate crystals that move, that are part of what causes, movement, causes the movement of those crystals, and that bends the hair cells. Sometimes those crystals break off and get out of the utricle or sacculus and get into the semicircular canals where they don't belong. And those crystals, when they're in the tubes of the semicircular canals, they will bump up against the hair cells of the semicircular canals, and that will cause this kind of unexpected dizziness, because they don't belong there. So there are therapeutic maneuvers to get those away from the hair cells until they're reabsorbed into the system. So that kind of usually dizziness is caused by, maybe you'll sit up suddenly and those calcium carbonate crystals will bump into some of the hair cell receptors where they shouldn't be doing that. So that's a treatment that is frequently done by therapists to help get them back where they belong, or to be reabsorbed into the fluids of the system.
Thank you.
Riley had a question about vertigo as well. Do you want to go ahead?
Yeah. Can you hear me?
Yes.
Yep.
Okay, great. Yeah, maybe a year ago I've only had one bout of vertigo. It was very unpleasant. And I'm just curious as to, I'm assuming that's a condition of the vestibular system, or
Yes.
somehow the system is affected by that. And is there anything, I know there's I forget it now, but my doctor neighbor told me there's a way you can lie down on a flat surface in a certain way, and eventually it kind of rights itself, which it finally did. But I'm wondering what you can say about that. I've always been curious. I've only had it happen once, and it was no fun.
That it really is a very unpleasant experience, and it can be recurrent, but that is exactly what I was talking about. Calcium
Okay.
carbonate crystals are breaking off from the two receptors, the sacculus and the utricle, and getting into the semicircular canals where they don't belong. And there are several
Okay.
different types of head maneuvers. There's the Epley procedure and the Dix-Hallpike. There are different procedures done by a trained therapist to do head repositioning to get those crystals away from the hair cells until they are reabsorbed by the system. So it sounds like yours were, quickly, they were quickly removed from where they didn't belong or got reabsorbed. And fortunately, you haven't had a recurrence. Sometimes people have that happen recurrently, and there are various causes for that. A trauma to the head can break off those crystals, or it could be nutritionally. There are many different possibilities of what would cause this to happen.
Okay, thank you.
Yeah. Trish, or Trish's tile person has a question.
Yes, this is Trisha's husband, Lauren
Hi.
Hare. Hello. Thank you for an excellent presentation. I have the condition that you've just described with the loose otoliths, and I practice martial arts, and I don't have general vertigo. I generally have good balance, but when I would normally do a forward roll, which would be a complete 360 degrees in the vertical, well, actually around the x-axis, right? And so I'm tumbling head over heels safely, right? Which I've been doing for years, right? I now have a sense of, swimming in the inner ear fluids, which is not exactly dizzy like around and around, but as if I'm inside of a swimming pool trying to move. And so I saw a therapist who tried the positional therapies that you mentioned.
Uh-huh.
And they said, well, we can't get a definitive angle where this always happens. And so, sorry, but you're going to have to live with it. And I wonder if there's, and I am living with it. I just can't do this particular thing anymore. And I wonder if there's a follow-up or a further kind of therapy beyond the simple positional therapy that I got at my, HMO.
Well, yeah, possibly, like, I mentioned like that spatial device that I was in that was doing all of this stimulation.
Yes.
Some vestibular problems, and there are many different kinds of them. The repetition of the movement that triggers the adverse effect is sometimes mitigated by repetition. But I don't know in your case whether that would, I don't know how bad the symptoms are when you do it. But if it's something that's tolerable and you easily recover from, it is, I'm hesitant to suggest this, but probably if it were
Right.
me, I would see if doing this over time, repeating it, if it gets better. Or if,
And so, right, in other words, instead of taking one roll, take 3 in a row.
or take, if you're just doing one roll once a day or once a week, try to do 2 rolls. Try to gradually increase it. If, as I said, that would only be if the symptoms are well tolerated, to see if you can build a tolerance, because many of the vestibular rehab programs, it's a conditioning of adding the input, adding repetitions over time will correct some of the problems. But in your particular problem, I wouldn't know unless I were to try to see if I can get that to not be triggered from the movement over time by more frequent stimulation. For example, there are some children that are very hypersensitive to movement, like every time they ride in a car, they will vomit. I've worked with many children like that, and by providing more activation of all 5 of the vestibular receptors, that gradually goes away. So in some cases that can happen, but if you have a problem and doing it repeatedly doesn't make any improvement, then obviously that's not one that's going to respond to the repetition.
And that's very helpful. Thank you. And I just want to have one follow-up. By repetition, are we trying to desensitize or trying to learn?
It's trying to get a more typical response. Just like when we're learning to walk, the first time that an infant or a toddler stands up to walk, they don't do a very good, it's not very successful, but they keep doing it and it gets better and better and better with the repetition. But of course, not everything is that way. But there are many vestibular issues. Hypersensitivity is often improved, like some of people who get dizzy very easily. If they keep doing those movements, gradually, not overdoing it, but gradually and frequently, that may totally resolve.
Thank you very much.
Thank you. Sally's been waiting to ask her question.
Yes, I actually put it in the chat as well, but I've done the Epley procedure because I had a very bad neck injury, and then I had it kind of flared up, and I tried to do it by myself. I recommend doing it with a therapist. It's very hard to do it by yourself.
Absolutely.
Yeah, but I had a question about, I do the European tapping system.
You're cutting out. You did a European tapping system?
Yes, and I'm demonstrating what I do.
Oh,
Above
I
here,
can't see you. But is it causing some movement of the head?
No, it's a
Or-
tapping above the eye, beside the eye, below the eyes, above the mouth, below the mouth, and then the vagus nerve on the collarbone to stimulate the vagus nerve.
Yeah.
And I'm wondering if this could help with balance. I no longer seem to have much of a balance issue, although after my neck injury, it was pretty intense.
Well, a neck injury is going to really throw off the muscle balance. Well, even when you just tap the head, that's causing some fluid movement within the vestibular system. And you're working directly. The vestibular system has a huge interaction with the vagus nerve. Our whole sympathetic, parasympathetic relationship, the balance between those two things is very much under the influence of the vestibular system. And so that's why, when you have an issue with balance, you get triggered into a very sympathetic state. Your muscles all tighten down, you become more protective because that, the communication is really one of threat. And so that anxiety is definitely in part because of the vestibular compromise.
Right. I also, as a second part of this, I live in a facility where there are many people who are somewhat demented, but also these people are heavily medicated, many of them. And I've been asked to take medicines by doctors, and I've refused because when I read the side effects, the loss of balance is one of them. And we have a lot of people who've fallen and go to, they go to the hospital, they go to rehab, they come home, they fall again, they go to rehab, and they die. This is just a pattern that I've observed over and over. And I'm wondering, can you comment about the side effects of medication and the effect on balance?
Well, there are so many medications, but what I would say is that, when you have to do take medications that do compromise your balance, and you may have balance issues anyway. The part that I'm comfortable talking about is how to move safely and as much as possible to keep the vestibular system functioning optimally, without the aid of drugs or anything else. I really don't feel qualified to get into talking about the mix, but unfortunately, we're living in a world where medication is often, doctors are prescribing medication, but they're not saying, you need to move throughout the day. You need to do it safely, but you can't be sedentary, because that is going to cause you to have balance problems.
Thank you.
Joe's next on the questions.
Mary, a simple question. We've kind of danced around it, perhaps. Why do some people experience motion sickness in all its forms, whether it's the backseat of a car or a handheld camera or on a ship, and other people don't experience it at all, or at least very little?
Well, it's a system that doesn't work the same. I mentioned that there are sometimes genetic issues. So just like genetically, some of us are really have a very sturdy vestibular system, and others may be prone to, sometimes clients I've seen, there are multi-generational issues with vestibular issues. So it is somewhat variable. But, having worked with doing movement therapy with a lot of clients over time, in general, I feel that natural ways of moving the body like it's designed to move, if your body is not doing what it's designed to do, and you can be guided to do movements that are more according to the design of the body, that often you can make some very nice improvements from just simple things, like the simple thing I told you about, rotating the head and getting the head in different positions. Sometimes these can make really profound changes.
Thank you.
Roger was next.
I'd like to know if there's any connection between tinnitus and the vestibular system and whether they interact or not. That's my first question.
Tinnitus is in part a vestibular issue, and it's a very, very challenging one. It's an area that I have not addressed from a therapeutic perspective, but it's one that is not easily manifested. There doesn't seem to be a really powerful strategy for eliminating it in many cases. But it definitely is impacting the vestibular system. It's one of the symptoms of vestibular dysfunction.
My second question is that recently I've started to feel vertigo when on the edge of something with a big drop, but not at other times. And do you have anything to say about that?
Well, I did address very briefly the interaction between the visual system and the vestibular system. And so a lot of our balance is being supported by the visual system. And, our peripheral vision, movement in the periphery triggers our awareness of the total surround. And so as we start to lose some of our really optimal functioning, it may start out by being more of seeming a visual issue, but the interaction between vision and vestibular function those two systems are so closely aligned in terms of what they do, that I would say some part of that vestibulo-ocular function is beginning to slip, and it's showing up primarily in a spatial, visual spatial consideration. And there's been some testing on normal people or people without dysfunction and people with dysfunction, and if the spatial components start to slip, there are postural changes that start to happen. They've found, like, even in people who don't have any issues, if you put them up in high in a situation where there's a height issue where you could fall, that the body stiffens, so it loses some of its flexibility, and so it's having a subtle impact on the entire system, but it could be showing up as more of a visual issue to start with. Is that helpful?
Sarah Sunstein had been waiting for make a comment and a question, maybe.
Oh, I don't know that. Well, my comment was that when people were talking about the positional vertigo things, I had it for quite a long time, and I won't even go into why I think it started, but acupuncture finally helped. and I've had it off and on again over the years. And so I do body work, and so have some of my clients. And I found that craniosacral work, cranial work really helps a lot. Not with everyone, but certainly a lot. And with myself as well. So that becomes another possibility for those of you who are epi failures, as I was, and other types. Okay, that's it. Thank you.
I just,
Thank
you know,
you.
that's just a beautiful example of how interconnected our entire system is. And so you can come into the system through various kinds of strategies and make some huge changes. But there's so much variability from one individual to another that, you know, the ideal treatment for one person may not be for another person. But it's all of the systems. When you might be going into one system, but that network of connection, the sensory connection of all of the motor control is really we really don't even have a foothold on how extensive that is yet. Where the research is just beginning to you know, peel through some of the layers of these interconnections.
Elizabeth is the next on the question list.
Yeah, am I muted?
Yep, no, you're good.
Yeah, I think so. I've got multiple questions, but the one that is uppermost right now is I've had a couple of falls over the last couple of months, and finally I ended up with a concussion on the 19th, and then I just fell again on the 7th. And one of the things that I noticed, I think there's a correlation, and it sounds like with the peripheral vision that you're talking about, is that I don't know that my cataract surgery was, it's left a slit of where light really impinges, and it makes me want to close my eyes, and that's not a good thing to do when you're moving, obviously, but because the lenses leave some space, but the new lenses, and so there's that kind of effect, and it seems to have gotten worse, and then it got worse after the COVID and all that. But I don't know why the ophthalmologists don't seem to look into that.
Well, unfortunately, there still are a lot of professionals that are very good going in depth into the system that they're working on, but they are not up on some of the latest interaction between systems. So you know, that's a possibility, but there is a huge interaction between the visual and the vestibular systems.
Yeah.
And so you might want to try checking with another professional to see, because having good peripheral vision is critical. You know, when we're looking at something in our environment, we're seeing what hopefully, if our eyes are aligning with that, with what we're looking at, we're seeing that very clearly. But we have a wide area beyond that where, like, we're aware of, there's a window here, there's a wall, and particularly when things move in our periphery, that triggers our peripheral vision. And the peripheral vision does a lot to support our balance. So it's important to keep that open. And again, that's one of the reasons why we need to move, because when we move, we create a visual flow that keeps that peripheral vision really active, so that it can in fact do what it's designed to do to support our balance and many other things.
Yeah, I've been walking for a number of years in the forest, and the ophthalmologist said, "Oh, you need distance glasses," because there was a small imbalance. So I tried them, and I looked in the forest, and it just changed it completely. It was too much information And my balance is it has been off clearly, and I'm hard of hearing as well. So I wear hearing aids, but anyway, I am looking forward to finding a good therapist for this particular thing.
I commend you for finding someone who really can address it much more comprehensively around your issues would be very, very important.
Yeah, I really appreciate this presentation and your clarity and
thank you.
Goodness.
It was just the tip of the iceberg.
Yeah.
I usually talk about these things for 2 days, and I was a little overwhelmed with how to give a little bit of information and make it of value. So hopefully it has been helpful.
Oh, thank you.
Joan has a follow-up question. Go ahead.
Yes, your talk has reminded me of something that happened many, many years ago, several times. When I was pregnant, I had episodes of dizziness and nausea during movement. Like, for example, I couldn't swing on a swing when I was pregnant, and I could swing very well any other time. And I'm just wondering, what's the relationship between pregnancy and the vestibular system?
Well, when you're pregnant, your whole distribution of weight in your body changes dramatically over time. And so all of that has to be recalibrated. Vestibular system, it may work at one point in time, it might work beautifully, but when anything changes, it does require recalibration. And that recalibration, because vestibular input is so pervasive in the whole body, it can have an impact on things that you would think maybe aren't related to your movement at all, but they are, because of how we are designed, how we are wired neurologically.
Thank you.
Do we have any other questions?
No more questions in the chat.
Do you see any, Hillary?
Nothing, no more questions in the chat.
Oh, okay. Looks like Trisha's got a question.
Yeah, I was just going to make a comment that I think should be applicable to this group, which the last comment that she made, which is that I had hip surgery a year ago. And as I think about it, I'm in my early 70s. A lot of this stuff is that when I sit up is happening. And when she just said, when something big happens, you want to recalibrate. And so, I was thinking, oh, I'm aging and that's just the natural thing. But maybe after I can walk again and we deal with all the PT, the next thing is to do the PT with the vestibular systems so that we come back to a better kind of more before the surgery person that we were. And I just think I'd never had that thought before. And so we have a lot of orthopedic things at our ages. So thought I'd mention that.
Yeah, well, movement is so important. And when anything changes, we may have to relearn or recalibrate those movements. And so it, just like when you, as I mentioned, like a toddler learning to walk, it's an ongoing process where you have to keep it's somewhat trial and error. You try something and well, that didn't quite work, but hopefully you keep going till you find something that does make you moving more efficiently, more safely, by exploring it. Be open to exploring your movements and see if you can add a bit of a challenge to expand your repertoire of how you move.
Any other questions before well, looks like, or
Yes, I have one. I have just more of a, I guess, a comment, but I have both macular degeneration and glaucoma, and I have lost peripheral vision on one side almost totally. So this is a real balance challenge. And in order to cope, I've learned to put everything away, leave nothing on the floor, If I walk outside, I have a wheeled walker that I push before me, so it hits the cracks in the sidewalk before I do. And it's keeping me upright. It's keeping me from falling. And so if anyone
Oh.
else has these issues, these are just suggestions.
Yeah, that's wonderful. You're being very creative, and that's helping you to be, I'm sure it's helping you to be much more free and mobile than you would otherwise be if you weren't taking all of these.
Yeah, and never leave a cupboard door open, ever.
Right. And things that you
That's
have
a
in
good
your
one.
environment that didn't used to create a problem, at some point they are going to be a problem. So
Oh, yeah.
you need to be proactive, get those loose rugs out of the way, and and keep
Yeah.
Thresholds.
Sometimes we try to move in the dark, and then we're really excluding the ability of the visual system to help keep us safe.
Well,
I just wanted to say, I'm so grateful to hear all of this. It's so positive and inspiring.
Oh, thank you.
Thank you.
I would like to ask one last question. This is, I've of course never had a chance to talk with an astronaut. I'd like to ask you, Mary, what happens when an astronaut is in a spacecraft in a gravity-less condition and the craft starts to spin? What does the astronaut experience vis-a-vis everything in the vestibular system?
I actually can't specifically answer that, but this is what I can say that sort of, I think, relates to this. I did a presentation for the astronaut. There's an astronaut lab at Brandeis University, and I did a lecture that showed them the precise kinds of vestibular activation activities that I've developed, and I've developed a board that you put a person on and spin them, and you have to have the head in precise positions, different positions on this board. And the one of the researchers really liked my board. He said, I've been trying to talk our program into developing a board like this to put on a spaceship so that the astronauts can spin. So now I'd like to go back and ask him, his clinical reasoning around how what spinning would do to help maintain, probably in some way it has to do with help maintaining the integrity of the neuromuscular system.
Thank you. Do we have any other questions before we go? Otherwise, I would like to thank Mary on behalf of all of us. Wonderful presentation.
It was delightful. I loved it. My favorite topic, so always happy to share. But it's always better when I can do it with people, really work with people. It's hard to talk about movement in the abstract.
Okay, well, with that, thank you very much. Thank you, Hillary, for co-hosting, and thank you, Mary, one last time. We'll see you all next month.
You're most welcome.
Thank
Bye
you.
now.